Researchers from Harvard say that the county needs to take action to slow down this spread. Now, we told you yesterday that they said Mecklenburg County is at a tipping point. They suggest another stay-at-home order. So today, I spoke with the Harvard doctor behind the data who says there are a lot of factors involved here.
We're seeing increasing cases in South Carolina that may be spilling over the southern border into Mecklenburg County in North Carolina, which means there needs to be a targeted effort to really contain the pandemic before it spreads further throughout the rest of the state. This means that increasing the number of testing, the decreasing the time it takes for contact tracing to get back the information to individuals, and then also making sure that individuals are actually following through with the best guidance of physical distancing as well as wearing masks. And if the pandemic is starting to grow out of control in other places, it may mean not just putting a pause on reopening, but potentially even dialing back up into a more localized shutdown until we can buy time again to contain the pandemic.
So I'm curious what the data shows when it comes to a shutdown. Is that how they solve this issue, say, in New York?
Yes, there is emerging data that a shutdown is effective in not just keeping individuals at home and decreasing the amount of community transmission, but is now increasingly linked to being able to control the pandemic. We've seen it play out in states in the Northeast, in Massachusetts, in New York, for example, and more importantly, in other states around the country and other countries around the world. Once a pandemic gets to such a large extent, you may have to reinstitute a shutdown to put a lid back on the pot and then ramp up testing concurrently and contact tracing so we can actually contain it. There's no silver bullet to fighting the pandemic. We have to use all the tools we have in the toolbox in order to make sure we come on the other side. What happened is we started off with a peak of cases, we settled for a plateau, and it's now turning into a mountain range.
Now, looking at your map, I mean, you could almost draw a straight line all the way across the country, and everything south of there has multiple red counties, some whole red states. In fact, all the states that are in red are below that line. Why is that? These are the Sun Belt states. Is it travel? Are people vacationing? Is that what's going on?
We're seeing some increased mobility, so people leaving the home, being more active. A lot of these states also had earlier phased reopening. And at the time, some of these states were following the guidances in terms of only reopening when there was a low prevalence, a low burden of COVID-19 cases. But we have to keep in mind that that was contingent upon ramping up the testing infrastructure and the testing capacity and contact tracing infrastructure at the same time. It was not enough to have a low burden of cases and reopen, because what happens is that you're flying blind. Cases may be spreading in the community and you're just not aware of it because the testing wasn't there. So we're seeing the effects of reopening too soon without the right information.
So after speaking with Dr. Tsai about Mecklenburg County being at that tipping point, we did reach out to Novant Health. I asked them if they're at a tipping point when it comes to their hospitals.
At this point, I think we're doing okay. And part of it is, while there are a lot of patients coming in, we're able to get them out sooner because they're younger and they tend to do better. We have a number of clinical trials we are enrolling patients in. Our physicians and nurses are gaining valuable experience in how they care for these patients.
Well, when you look at the trends, I mean, I mentioned the Harvard study. They're calling Mecklenburg County a tipping point. They're saying South Carolina as a state is at a tipping point. Do you think the masks will be enough to reverse this trend?
I think it's a major part of this. And I know wearing masks has become a political issue. We really don't want it to be a political issue. We think it's a very simple way to protect people in the community. And we know that countries that have higher rates of wearing masks and communities that have higher rates of wearing masks have lower rates of transmission of the virus.
All right, let's look at the hospitalizations across the state. As of today, 989 people are in the hospital. Today, Dr. Mandy Cohen said while hospitalizations are up, the number of people in the ICU is down.